Big shifts in health policy, medical innovation, and wellness research this week. RFK Jr. takes on addiction and mental health. The FDA approves a breakthrough drug for an uncontrollable hunger disorder, and researchers may have found the sweet spot for intermittent fasting. Here are the top health stories making headlines this week. Newly appointed HHS Secretary Robert F. Kennedy Jr. is prioritizing addiction and mental health like never before. He's directing SAMHSA to focus on measurable outcomes like reducing suicide and overdose deaths while cutting through government red tape. He's also encouraging partnerships with faith-based and local organizations to better reach underserved communities. Diagnosing autoimmune encephalitis, a rare condition where the immune system attacks the brain, has been notoriously difficult. Now, Mayo Clinic researchers have developed a detailed diagnostic roadmap using antibody testing and early clinical indicators. The approach helps doctors intervene sooner, reducing misdiagnosis and improving outcomes for patients. The FDA just approved a new drug, DCCR, short for diazoxide choline controlled release. Sold under the name VYKAT XR, it's the first treatment for the extreme hunger caused by Prader-Willi syndrome, a rare genetic disorder. In clinical trials, patients taking VYKAT XR experienced reduced hunger and fewer food-related behaviors, offering hope to families with limited treatment options. Full-body MRI scans are all over social media, but many doctors say they're not worth the hype. These expensive scans often detect harmless abnormalities that lead to anxiety, unnecessary procedures, and high follow-up costs. Unless medically recommended, experts suggest skipping them. Hospitals are legally required to post their prices, but a new investigation shows that many price lists are missing, hard to find, or filled with confusing codes. Patients are still struggling to understand what their care will cost, even years after the transparency rules went into effect. New research published in Cell Metabolism suggests there may be a sweet spot for intermittent fasting. Eating within a 6 to 10 hour window each day was linked to better weight management, improved metabolic health, and balanced blood sugar. Longer fasting windows didn't lead to better results, and might even backfire in some cases. Let's wrap up with 2 quick headlines you should know. A biotech company in China successfully implanted a brain chip that allowed a human to control a computer using only thought. Following this breakthrough, researchers are accelerating human trials. Meanwhile, pediatricians across the U.S. are sounding the alarm after the government abruptly ended funding for local vaccine outreach programs. Doctors worry this could lead to fewer childhood vaccinations and more preventable disease outbreaks. That's your health news roundup for the week. For more updates and expert-curated insights, subscribe and visit healthpost360.com. See you next time.